There was obviously something going wrong. My hormones were off. I started to Google, which is what patients do these days, and told the doctors, this is what I think I have. And they laughed at me and said, no, everybody your age has these problems. And I remember thinking, if everybody my age has these problems, we're living in a terribly sick society.
Welcome to the Block and Tackle Show, hosted by Carl Block. Carl is a partner in the law firm of Loeb and Loeb here in Los Angeles, California. He'll be tackling some of the biggest issues in business today. Welcome to the show.
I would imagine when a doctor sees a patient and this tool isn't there, if somebody, they're not good communicators. They come into a doctor and the doctor has to start with ground zero. If somebody uses Agora, then even if they're not the best communicator, they can print out something and show it to the doctor. And I mean, I think most doctors would say they prefer more information than less. And so it seems like you could bridge an incredible potential information gap instead of the doctor having to starting out in that 15 minutes being the forensic detective. There's already like a detective's case put together, even though these people aren't medically trained, but this information is there for the provider to decide what they think is valuable, what isn't, but potentially even putting them in the right direction to help with the patient outcome.
Absolutely. This is the beauty and tool of technology. When it's used in the right way, it makes everybody's lives much better. And technology can even be used to summarize the whole thing the patient's saying so that the doctor can more easily pinpoint and treat.
That's great. You must be pretty popular when you offer this. How is it when you speak to people in the healthcare community? And it's so different than anything else they've probably ever seen. What kind of reactions do you get when you and Olivia talk to other healthcare providers?
I think the medical community, they are and will continue to be extremely excited and happy as we are, because we're literally acting as their eyes and ears on the ground for new innovative technologies. And we're saving them time and effort having to do this themselves, right? It's like we just said, doctors are working tirelessly to help their patients and they want better outcomes. So our solution will make their lives easier and make this possible.
That's great. So if we could talk a little bit more about your growing up and about the stress that you had, because I want to ultimately get to thinking about the mental health side of this too, and how when the mental health community, I know that we don't have enough healthcare providers there. And we also know that mental health issues can cause lots of physical issues like we talked about before. So in your background and your journey about the stresses you had and how it got to you. Is it okay if we talk a little bit more about that? You tell our viewers and listeners a little bit more?
For sure. Which part do you think?
Well, when you were talking about how when you finally got to the point where you had the 9-to-5 job, but you carried all this stuff with you, it must have been hard to think about, like, why are things going wrong? And just how were you processing the stress?
Yeah, not very well. I was sleeping sometimes 14, 20 hours a day. So I end up, from Australia to Finland, the happiest nation in the world. My life is better than it's ever been. So I went through the healthcare system and questionnaires. How do you feel? And there was obviously something going wrong. My hormones were off, all these things that you see. But the doctors, they basically, I started to Google, which is what patients do these days. We have access to so much information, and told them, this is what I think I have. And they laughed at me and said, no, everybody your age has these problems. And I remember thinking, if everybody my age has these problems, we're living in a terribly sick society. And it took many years going through the systems, taking all kinds of lab tests on my own through the healthcare systems to try to find what was wrong. And it turned out actually that I had a brain tumor, which was on my pituitary gland, which was causing hormonal issues, which was causing all these, mold poisoning, all these other sort of seemingly unrelated issues. And being able to know what was actually happening in my body and brain was a game changer, because now I went from what's wrong with me, I don't know what's wrong with me, to, oh, this is what's happening, this is how the body is working, and here's what I can do about it, which is very empowering.
Oh, that's great. I think you know that there are some people who believe there is a mental health crisis. And in a lot of developed countries, this country as well, that when they seek to go to a mental health professional, often they can't see one, or it takes months to get to see one that may or may not be a good fit. When you see this dynamic, and even if you get into a mental health professional, it's very much like I don't even have the time for a 50-minute or an hour patient session with you. What do you think Agora offers to people who are suffering with the kinds of things that we see, where frankly, oftentimes, because they can't get into a mental health professional, they'll have somebody, usually a primary care physician, who will prescribe something and get them out of the office? So how is Agora going to help those people?
Well, back to the basics. So, for example, we can do it right now. You don't need FDA approval or clearance or a doctor. Literally, you can take a deep breath, like we could do it together. You take a deep breath in and then in again, and you hold it and you breathe out as slowly as you possibly can. That's resetting the nervous system. And I didn't need anything to do it. That's something people can do right away. And then stack it with a technology, right? Vagus nerve stimulation, listening to these different frequencies that can measurably increase your sleep, which nobody who sleeps well, has terrible mental health issues. So everything. And for so long, we've been outsourcing this power to someone else to tell us what's happening in our bodies and brains. Now, when we can see, if we're willing to take 100% responsibility for our own life experience, because I think that's the thing, we can have amazing healthcare professionals and mental health care professionals, but at the end of the day, it's up to us to heal. No one can heal you for you unless they're like at a, Jesus level of healer. Most of the doctors still need your cooperation. So I think really empowering patients with the information and the frameworks and the tools needed gives them the ability to be able to take an active role in their own healing. I actually love my co-founder, Dr. Olivia. She says that even if you were the last person on this planet and all the healthcare professionals were gone, you could still heal. And I think it's important for people to know this and to really play a more active role than we have been up until now.
That's great. Okay, so you come across science in Agora, and that science might even be publicly available, open source, but a lot of doctors don't know that, do they?
Well, I think it's not even that they don't know, they don't have time. So if someone studies, 7 to 15 years or however much they study to become a doctor, information is constantly being discovered and scientific information is evolving continuously. And so they don't have 15 minutes to meet their patients. Where are they going to have the time to update and read the millions of new research papers coming out? And our tool at Agora, we're just shortening that for them and like, here's the most relevant science that you need to know. Here's how it pertains to your patient. Here's how you can use it for your benefit.
Wouldn't be easy for them to go try to do it yourself and find it and just Google and Google. I mean, you actually have access to scholarly written.
Yes, absolutely. So our solution is built with 200 million research papers, thousands of technologies. We're technology agnostic, so we're not stuck on no one is paying us to say this is the best thing. We're really looking at what is measurably helping patients and people to get better, feel better, and heal. Yeah, saving time. We can have more of everything, but the one thing we can't have more of is time. So all the tools that can help us save time.
In terms of some of the things that you have information about, I know one of them that you mentioned was biofeedback. Could you say, let us know some of the other things that you've heard about that healthcare providers are interested in that maybe a lot of us don't know about?
Yeah. So a simple one is when I was a kid, we used to think that the brain was the central processing unit of the body and it was telling all the other organs what to do. Now we know that's actually not true. The heart is talking to the stomach and the stomach is talking to the brain. The whole body is communicating with each other. And the way they do that is with a nerve that starts at the back of your neck and goes almost like branches of a tree throughout your body. It's called the vagus nerve. And there's actually one device in our solution, which is HSA, FSA approved. For those who don't know what that is, it's like an insurance that employers can get subsidies for. I guess you will know better. And they can get things from this marketplace. So this vagus nerve stimulator is on that list. And it really is plug and play. You can pick a program for stress, sleep, burnout, anxiety, pain. So when I had a brain tumor, nothing on earth was stopping the migraines. And I used the vagus nerve stimulator to ease the pain of that. So that's one example.
Okay. And as it occurs to me when you're talking about this and biofeedback and some of the other things that you have, do you guys do a lot of presenting now around the world because sometimes doctors do like to go to conferences and maybe other people in the healthcare industry do. Is that another way that you are able to energize people, get them interested and understand the benefits?
For sure. I've been fortunate to be on some of the biggest stages in the world. So at CES, which is the biggest tech conference in America, where you and I met, GITEX in Dubai. I was at the Grammys this weekend. So I think it's really bringing to the attention of people who would normally not. Again, industries are siloed. So bringing to their attention new innovations, and being on stage is definitely a way to accelerate that.
That's great. I know you mentioned the vagus stimulator. Are a lot of the other things that are in your literature covered by insurance?
Definitely some of them, many of them, the more medical part, if there's any insurance companies watching, we'd love to work with you, because really preventative personalized health is the future. It's going to help you save money, make money, have better patient outcomes. So really all players are going to be needed to solve this global mental health crisis, as you say, the hospitals, the people, the insurance companies, we all have a part to play.
And by the way, I do think that in the insurance industry, they are very interested both in preventative care, but also self-directed decisions by patients. It just, for a number of reasons, including some who believe that patients know their bodies the best, the fact that there is a shortage of good people in healthcare in many areas, and the patients also saying, well, I've heard this advice, but I don't want to do that. And I think that the insurance companies would actually love something that puts more control in the patient's hands about what their outcomes are.
Yeah, you make a good point. There's no one in the world who knows your body better than you. And as such, you're the best person living in there 24/7 of every day for however many years, that to know what's good. And one of the main elements of Agora is teaching people and providing them the frameworks to really connect with that ancestral wisdom, the evolutionary wisdom that comes from our brains simply evolving, our bodies evolving over time.
Do you think, on a related matter, there's been a lot of discussion about pharmaceutical products manufactured by pharmaceutical companies versus natural remedies? In Agora, is there a lot of research available about natural remedies, homeopathic remedies?
For sure. So homeopathic, maybe not, but for example, Chinese medicine, it's over 5,000 years old. There's millions and millions of studies supporting that. Ayurveda, millions of studies, and that's integrated. We've integrated those two into our solutions. Interesting statistics. So this is the real numbers. I was reading a research paper the other day with opioids. So that's all the painkillers, depression, anxiety, all those kind of drugs, pharmaceutical drugs. If they have like a 40% chance of success in a study done, it was on the Harvard website, the placebo had a 38% success in the same study. So there's not a lot of difference in that. So yeah, definitely integrating it all. Thank God for medicine. It saved many people's lives. And I think it's mostly dealing with the symptoms and not the cause. And what we look at Agora is, how do we solve the reason? Olivia says, yes, but why? A doctor should be saying, yes, you've got cancer, but why? Why is this extremely intelligent body that can turn an embryo to a baby letting this thing happen? What is it trying to protect the body from?
That's a very interesting perspective. She still practices medicine too?
Yes, she's based out of Australia, but both of us basically live between 3 continents and attend conferences everywhere.
Okay, that's great. So let me ask you, because we sort of let people know about your background in the beginning. Tell us about women in defense and some of the other things that you've been involved in. You seem to have a culture of excellence and achievement in many areas, far more. I mean, the equivalent for me is, oh, well, I'm a lawyer, but I'm also an accountant, and I'm also trained in medicine. You have a very interesting background. So why don't you tell our audience about that?
Well, I think it's because I come from a long line of humanitarians, so it's kind of their shoulders that I stand on. And so when I was 13, I was asked to stop school to help fundraise and take care of children. 15, opened a care home for children who had been orphaned by AIDS. 17, did earthquake emergency disaster. 18, went to work with refugees in the Middle East. So at some point in my 20s, I realized that, okay, I've been raising millions of dollars and this is not going to fix the world. So who is running the world and how can I have a seat at the table and really impact the world in bigger ways? And that's really what has led me to do things like Women in Defense and Space Alliance, Women on Board, getting more women into leadership roles. I think we can't complain about people running the world if we're not willing to step up and be involved in those industries.
I get it, but it's just defense is seemingly so disconnected from healthcare and wellness. And how did you get passionate about that?
The people who are in leadership, I think they need good health more than anybody. I mean, imagine running a country or a big army or military or government department. That must be an extremely stressful job. It must have an impact on your children, on your relationships, on your sleep, every decision you make. So I think of everybody, I'm happy to help orphan children, but if I can help one CEO, one general, and impact his or her life, it's going to affect millions of people's lives and the decisions they make. So I think consciousness should be infused into every department, especially defense and nuclear and space and all these things that impact all of us.
And I mean, look, that's great. Any closing thoughts from you?
Yes, for sure. The main thing, be 100% responsible for your own experience. Whatever we assume to be true will be true for you. We spell with our words. That's why they call it spelling. And yes, go check out our solution. It's givememyhealth.com, so you can access it there. The basic version is free and the other version is only $2 a month. So very easy to start being healthy.
All right. So listen, it's been a joy to have you on. And for the audience, if you have questions, email me at Carl with a K at blockandtackleshow.com. The and is not an ampersand. It's A-N-D. If they are questions for Elizabeth, I will forward them on. She's very responsive. You can tell from having seen or listened to this podcast, she's on it, and appreciate your comments and thoughts and also any questions you may have. Elizabeth, really appreciate you coming here today.
Thank you so much for inviting me.
Oh, my pleasure. Thanks for tuning in. If you want more info on the show, please visit blockandtackleshow.com. And you can also email me at carl@blockandtackleshow.com. Thanks for tuning in.